Well, hello, welcome to another Cambridge conversation, this one entitled The Locked Down Mind. 1 in 4 of the world's population, we think, at the moment are confined to just four walls, or in some cases, just one room. Never in the history of humankind, as far as we know it, has our civil liberty been eroded in this way, owing to a pandemic. But what is the implication of this? What are the consequences to our mental health, not just our physical health, of coronavirus infection? Well, with me to discuss this is Ed Bullmore. He's head of department at the University of Cambridge's Department of Psychiatry. Earlier this year, in the Lancet Psychiatry, a journal, he called for urgent research into what the implications for mental health will be in terms of the short-term and long-term effects of COVID. And also with us, Sarah-Jayne Blakemore, who's an expert in adolescent mental health. Of course, adolescent times are a turbulent period in your life, whether there's a pandemic or not. So what do the added effects of handling a pandemic and dealing with the consequences on your family being locked down have on the developing brain as well? So we'll talk for about 20 minutes, and then we're going to be asking you at home to put your questions to Ed and to Sarah-Jayne. Sarah-Jayne, first of all, might as well find out how you've been coping with the lockdown. Has it been business as usual? I suspect your department's been shut, like most of the University of Cambridge.
My department shut in March, towards around the 20th of March, and I've been working at home since. Everything had to go online, my research, my teaching, and also my teenagers obviously can't be at school at the moment, so they're also at home.
A lot of people are saying they're trying to work at home, but the bandwidth, they can't get on the internet because there's a lot of downloading of Netflix going on.
It's when my children do a lot of online lessons with their school, and the Wi-Fi can be troubling at times.
What's your experience, Ed?
Well, so hello everybody, first of all. But I mean, I actually quite enjoyed lockdown in some ways, and I think that is because I'm lucky enough to have a family and a house and a garden, and I can do a lot of my work from home, and in some ways it's more efficient. So
many people are saying, actually, aren't they, that echoing what you're saying, many people are saying that they don't miss the commute.
I certainly don't miss the commute. But I think what it does make me reflect is that the impact of lockdown is not going to be the same for everybody, and there are many people living in much more difficult circumstances, where I think the impact of social restriction on their mental health is going to be in the opposite direction to the effect it's had on me. And I think that's something that we do need to be very thoughtful about as we sort of continue this discussion about the impact of COVID. It's not going to be the same for everybody.
Of course, there are impacts in terms of physical health, and very much that's been the focus of much of the reporting, much of the media attention has gone on what is happening to people acutely affected and infected with coronavirus. There are then the mental health repercussions of being locked down, loss of employment, the impact on your family life. But then there may also well be mental health and neurological consequences of being infected with coronavirus, I would think, as well, aren't there? Is anyone talking about that? I haven't heard anything mentioned about that.
There's quite a lot of talk about particularly neurological complications of COVID. And I think, as we go through this conversation, what we have to remember is that, we didn't know anything about COVID 6 months ago. Nobody did. This is a very new thing that's sprung upon us. And when the pandemic first hit, rightly, everybody's attention was focused on the acute medical complications. And people were surprised to see that there were quite common neurological complications. The first report came out from Wuhan, showing that about a third of COVID patients had some kind of neurological complication, particularly the more severely ill people. And that
what sort of complications, Ed? What were they saying they had wrong with them?
Okay, so it's a mix of things. And if you look at the sort of largest data sets that we have available, which is still quite small, it seems like about a half of the neurological complications are strokes of one sort or another, which remind us that one of the things this virus does is it changes the blood's coagulation system. It makes blood more likely to clot, and you see evidence of that throughout the body, including the brain. So strokes are quite common. But there are other complications that have been reported too. Psychosis has cropped up in a surprising number of cases. Encephalitis, which is inflammation of the brain, has been reported. And there are a number of other disorders, some of them suggesting that the problem is not so much the virus as the body's immune response to the virus. So we're seeing sort of neurological presentations that would normally be regarded as autoimmune disorders coming out of COVID as well. And that's just the acute side of this.
And then the long term, of course, we're going to be finding out about this because we're effectively doing a massive natural experiment here, aren't we, involving the entire world's population?
Mm. Well, to be honest, I think natural experiment, it's sort of up there with herd immunity as a sort of, a difficult soundbite in how we talk about this. One hesitates to use the phrase in relation to something that is causing so much distress to so many people. But you're right, if you do step back at it and you look at it from a sort of a cold-blooded scientific point of view, in some ways this is a remarkable experiment. We have a large chunk of the population exposed to a virus, and we also have the entire population exposed to the unprecedented social restriction measures in place. And that does give us scientifically an opportunity to find out a lot more, both about the virus itself and how people respond to this kind of social isolation.
But before all this started, Sarah-Jayne, you were actually doing quite a lot of studies already on the youth of today, how their development might be impacted by social media. And it's interesting that social media had attracted quite a lot of negative press around development and depression. And actually, it might turn into a bit of a panacea in this situation.
Yeah. So just to go back to what you were talking about with Ed, the concept of a natural experiment, to me, the phrase natural experiment just highlights the massive uncertainties that exist around this situation. We just don't know. We have never been in this situation before in terms of things like lockdown and the consequences of lockdown on child development and mental health. And that's where I think this is a natural experiment. It's not a scientifically designed experiment, but we have no idea what the consequences will be, and we will find out in time. But yeah, so my research for many years has focused on the development of the brain, and particularly the development of the social brain and social behavior during adolescence in humans. We know that adolescence is a sort of sensitive period of social brain development, and adolescents become particularly interested in their social world. Their social world is generally quite complex, and they have to figure out where they are in the social hierarchies. They become really interested in what their friends think about them, and this is all because their adolescence, the period of adolescence, is about developing a sense of self-identity, and particularly a sense of social self. That is how other people see you. So your peers, how you interact with your peers, really matters during adolescence. We know, for example,
and so sorry to interrupt, Sarah-Jayne. So having schools shut then is actually a major impact for these people, because the normal socialization that would go on, the normal interactions that would help that developmental process are not there. The support networks are also not there in the same way.
For 2 months, adolescents, like everyone, weren't allowed any face-to-face interactions with their peers. They are now, but in these socially distant small groups, which is not how adolescents or children naturally interact with each other. They don't go for socially distant walks. The main way they do their social interaction is at school. That's where they organise to see each other after school at the weekend. So yeah, the shutdown of schools is, we assume and we predict, is having a huge impact on their social development.
If you look at evidence we have from animals, there are animals that are very social as well. Okay, it's arguable whether or not animals go through the same adolescence in quite the same way humans do, but if you do the equivalent of what the lockdown has done to some of our teenagers to experimental animals, how does their mental health and mental development get impacted?
Yeah, animals do actually go through adolescence. All species of animal go through a sort of a period between going through puberty and becoming fully sexually mature adults. So, for example, mice and rats, which are the animals in many labs that do research in this area, go through about 35 days of adolescence. And what's interesting is that in that short period of time, you can measure things like increases in risk taking, increases in the exploration of their environments, and changes in social behavior. So adolescent typical behavior that we see in humans can also be seen in adolescent animals.
And if we do the equivalent of a lockdown on them, what happens to them?
Yeah, so there's a lot of research on that from over the last 30 or 40 years, where animals, particularly mice and rats, are deprived of social interaction during adolescence. And what that research has shown many, many times is that social isolation has unique effects on brain development and behavioral development and mental health during adolescence. And in many ways, it is more damaging. So social isolation in adolescence is more damaging than the same social isolation either before adolescence or in adulthood.
If I could just remind everyone, don't forget to send in your questions for us, because in about 10 or 15 minutes time, then Sarah-Jayne and Ed will be able to answer the questions that you're sending in. So do submit those now. Tell us a bit about yourself and your context as to why you would like to know that too. That will help the discussion. So Ed, from what Sarah-Jayne is saying, there's quite a high likelihood that these individuals that we're seeing potentially impacts on today could become cases for studies in the future that you're going to be looking at. Effectively, they're going to turn into patients for you in the future if we don't do something about this.
Yes, I think that is a risk. I mean, I think it's just worth picking up on something else that sort of Sarah-Jayne implied, which is that at the moment we suspect that social restriction is having a major impact on mental health, but we don't know as much about that as we'd like to. And if I can just reflect from the point of view of the local NHS in Cambridge and surrounding areas, when lockdown hit and subsequently, we have not seen a surge of cases coming through for mental health treatment. In fact, the number of people wanting access to mental health services has dropped off a cliff, as it did for physical health. Other than COVID at the time of lockdown, people are basically staying away from hospitals and doctors at the moment, or those services are finding it difficult to reach their patients.
Do you think then
we think there's
that
a lot of demand?
I was just going to say, Ed, do you think then that we're brewing up at what we're dubbing a clinical iceberg here, where you're seeing the tip of the iceberg? Those are the ones that are coming to your attention, but under the waterline there is this enormous burden of ill health, whether that's mental ill health or physical ill health, that's being brewed up because we're diverting a lot of energy, effort and resources into looking after people who have coronavirus or might have coronavirus.
Yeah, I think that's exactly what's going on. And I mean, again, in Cambridge, the NHS rightly pivoted towards COVID. And, the whole of Edinburgh's hospital was pretty much repurposed as a COVID hospital. Many operations were cancelled and so on and so forth. And we see the same in mental health. But it will emerge as I think lockdown lifts a little bit. One of the things that I would expect to see is a sort of late surge in mental health referrals coming through. It's sort of a second, not exactly a second wave in terms of the virus, but a second surge of medical complications. This time, perhaps not so life-threatening that they sort of compel people to go to the hospital in the very early stages.
And Sarah-Jayne, what's worrying you the most then? If you had to make a list of things that you think are the biggest risks looking downstream of where we are now, not so much short term, but longer term, thinking to the future, what's got you the most worried?
Well, I mean, because I work with adolescents and particularly the need for social interaction and social learning during adolescence, it does worry me that adolescents are still not having allowed to have normal social interactions with their peers. But actually, just to come back on something that Ed says, I think what's really important is that there are individual differences, of course. It's not that all adolescents are going to be suffering from this. I mean, I remember watching a video from Bernardo's right in early on in the lockdown here in the UK, interviewing young people and children who were the victims of bullies at school. And for them, not having to go to school every day, not having to be put into this very stressful environment every day was a positive thing. So for some children and young people, not having to go to school, school is a stressful place, both socially and academically, and not having to go there every day might be a positive thing. But I think now, and again, going back to what Ed was saying about referrals declining early on in lockdown, I wonder whether now that it's been 3 months where young people haven't been able to see their friends and have been really quite isolated, whether now is when you'll start to see the increase in anxiety and possibly depression in young people as a cause of the lockdown. Again, it's completely speculative, but that's what really worries me.
If I may thread in a question for you, Sarah-Jayne, from Les, just very briefly, and then we'll come back to you in a second, Ed, because Les says, surely the widespread use of social media by children must mitigate some of the adverse effects of the constraints on social contact that's coming about through not being able to go to school. So this is sort of what I hinted at just now, where previously we thought social media is a bit of a demon, but in fact it may actually be coming to our rescue. Have you actually got any evidence on this, or are you taking advantage of the situation to get some evidence around this?
Absolutely, and thank you, Les, for reminding me that I didn't answer that question when Chris asked it, first of all. Yes, I mean, social media is a very normal way that young people interact socially now at the moment, and has been for the last few years, which can only be a positive thing, really, given that that's the only way a lot of young people are able to interact with each other right now. So we've, together with my colleagues Amy Orban and Livia Tomova, we just wrote a paper on this in the Lancet Child and Adolescent Health, where we talked about the potentially mitigating effects of social media. Particularly what we call active social media. That is where you're communicating actively with your friends, like messaging them or video calling them, as opposed to passive social media, which is like scrolling through other people's news feeds, which the only evidence, there is not very much evidence about how social media affects mental health in adolescents yet, but the small amount of evidence there is suggests that the kind of passive scrolling can have negative effects, whereas the active engagement and social interaction can be quite positive. So yes, I think that's right. There is potentially a mitigating effect there.
And Ed, if I may bring up one topic for you from Ed, who says there seems to be a fair amount of anecdotal data, anecdata as he dubs it, about disrupted sleep driven by anxiety, changed routines and other factors. Of course, all of those things are going to compound mental health problems, aren't they? But he goes on to say, do we understand, perhaps from historical parallels like wartime, what the likely effects of these sleep disturbances could be on the population?
Well, I agree. It's certainly an interesting question, and there has been a lot of talk about it. Again, it's an area where I don't think we have as much data as we'd like. And I'm not sure that it's clear what the mechanisms of these kind of sleep disturbances. You also hear people talking about very vivid or unusual dreams as a sort of lockdown experience. And I think for most people, that is going to be some kind of essentially psychological reaction, possibly compounded by the disturbance that everybody's had to their usual routines. I think it's also just worth bearing in mind that it is possible that the virus may have longer term effects on brain organization. I think one thing that is emerging anecdotally again, but I think is a very interesting lead, particularly in the US, people are talking about these long haulers, so-called. So these are people that have had COVID. They may have been in hospital and they've been well enough to be discharged, but their recovery is very slow. They're getting a lot of fatigue, I think a lot of sleep disturbance, probably a lot of mood disorder. And I think that's one possible factor for some of the sleep disturbance that we're seeing. But these people that long haul complications, psychological complications after infection, I think that is something that we are going to watch out for very carefully.
These symptoms very much parallel chronic fatigue syndrome, what we used to dub or sometimes still call ME, don't they?
Mm-hmm. Mm-hmm. Yep, they do. And of course, ME stands for myalgic encephalomyelitis. So it was originally thought to be a brain infection. And then sort of opinion shifted, and it became converted to the concept of chronic fatigue syndrome, which of course doesn't imply any particular infectious cause, but it's always been known that chronic fatigue is more common following viral infection. It's been a controversial area, but I think that, going back to the earlier conversation about natural experiment, I think the longer term consequences of COVID give us a great opportunity to understand exactly what's going on and what is it that drives chronic fatigue after viral infection. We should be able to answer that question more clearly than we've ever been able to before.
Sarah-Jayne, there's a point here from Vanessa who says, how can parents support children with their social development during lockdown? Do you have any advice or tips? That's a very good point, isn't it? We've dwelled very much on the negatives. What can we do about this problem?
Yeah, I mean, I can only really advise from an anecdotal point of view, from talking to many parents about their own children. I think okay, so now that young children and young people and all of us are allowed to meet outside, socially distanced, we can be encouraging our children to do that. It's tricky though, because it's not the way they normally will arrange to have their social interactions. It's not natural for them to go on socially distanced walks with a couple of other people. It's much more common for teenagers to hang out in big groups in cafes, for example, which isn't going to be possible for a long time, I imagine. But yeah, I mean, I just from my own point of view, I'm trying to encourage mine to meet up with their friends outdoors. And like my younger son, who's 12, he goes biking with a couple of friends now in the forests around here. And prior to that, and I guess this could be the case if further lockdowns happen where it becomes stricter again, I was actually kind of I was encouraging my children, and many of my friends were, to get online, and to, as opposed to years of telling them not to use their screens so much, I was encouraging them to log on and interact with their friends online.
So you found yourself going from bad parent to good parent, as it were, then?
Well, Amy Orban, who really is the kind of world expert in social media and mental health in adolescents, was slightly laughing that for years people have been so down on social media in adolescents, and now all of a sudden they were encouraging their children to take it up. But yeah, I mean, it is tricky. I think another thing is talking to children and teenagers about how they're coping and what they miss and what they want to do is probably a good thing as well.
Ed, really interesting point raised by Simon, which I wish I'd thought of this actually. He says, in contrast to the tip of the iceberg comments about lack of patience at Cambridge's NHS, do Ed and Sarah-Jayne think that the simpler life and calmer lifestyle of lockdown could have helped a cohort of people who were previously suffering with worries, issues, mental health complaints? Do you think that we started this thing by saying neither of us missed the commute? Do you think there's something in that?
Well, I think it's an optimistic way of looking at things. There is literature out there to suggest that actually, when populations are confronted by a common enemy, that can be good for mental health, the sense of being all in it together. But I come back to one of the things I said at the outset, which is I don't think this is hitting us all the same way. I'm in a quite a comfortable position now. I think there are plenty of people, the scenario that I think we are seeing surfacing, for example, is women typically who are victims of domestic violence, who may be locked down in a very hostile home environment with nowhere to escape to. I mean, that's obviously going to be a very different experience to lockdown compared to my own. So I think we have to be careful about those sort of generalizations. I think it's nice to hold on to the idea, and there may well be some truth in it, that while we are united in our response to the virus, there is some mental health benefit. But I would then predict that as lockdown eases, and particularly as the economic consequences become a bit more obvious, and we're no longer so united perhaps in the way that this experience is affecting us all, then whatever benefit there may have been from that experience of being united against a common foe may evaporate, and what we may be left with is a rather polarized society where people who have lost employment or in other ways suffered, particularly during the acute phase of the pandemic, may find themselves in a very different situation in terms of their mental health.
Did you want to come in on that, Sarah-Jayne? Because, of course, one of the other aspects of this is that the children themselves are going to be victims of what happens to their parents. And if life deteriorates because your parents lose their jobs or their livelihoods and money becomes tight, that's going to have presumably a big impact as well.
I think one of the biggest issues is the inequalities. I mean, inequalities in this country were already quite large before COVID, but the inequalities now have just been massively increased, particularly for children and young people. So, for example, in terms of education, there are some children who are getting really good online lessons from their school and who are learning almost as much as they would do if they were at school. But at the other end of the spectrum, there are many, many children who are getting no learning at all. So they're effectively missing what will be, if they go back in September, 6 months of school. And that's for a variety of reasons. Sometimes it's because the school doesn't have the resources to do good online teaching. Often it's because the children live in homes where there's no space, there's no Wi-Fi, there's no laptop, there's not a family environment that's conducive to online learning. But these inequalities are really troubling, particularly because they will affect the already disadvantaged children and adolescents the most. And so there's a lot of discussion in education policy about how to handle that. For example, in terms of GCSEs and A-levels next year. So this year they were cancelled, and children and young people are being given marks by their teachers. Next year, the question is what to do, because while some year 10, for example, children, that's the year before GCSEs, will have got a decent amount of learning over this lockdown, there are many year 10 students who will effectively miss about a quarter or a fifth of the content of their GCSEs. So how do you handle that? Should you cancel exams and move to the assessment based grading like has happened this year, or do you reduce the content of exams or push back the exams by a couple of months? Anyway, it's all up in the air. It's a really, really big problem. And the children who are, of course, the most disadvantaged, I mean, for them, shutting down school, it's not just about a deprivation of learning and academic attainment, but also the lack of social interaction and structure and extracurricular activity, sport. And for some children, home is not a safe place. It's not safe for them to be at home, and they are not. They're nutritionally neglected. They're not getting enough to eat, and worse in some cases, like in cases of abuse. So this is a massive crisis, really, that we're in terms of the social care of young people and children.
Interesting point raised by Natalie, who says, my daughter's 4 and she's just beginning to have conscious memories. She won't remember a normal time before COVID. So how can we support very young children so they don't suffer long-term issues? I think that's an important point, isn't it? Because a child could grow up thinking this is normal, and therefore there could be lifelong legacy effects of the way we're having to behave at the moment, because what they crystallize in their mind as the normal way to behave actually isn't.
Yeah, I mean, one thing about children, and talking to other people developmental psychologists who work with young children. So my work focuses on teenagers, but developmental psychologists who work with young children and knowing young children, is that they are highly adaptive. So they can adapt to new circumstances. One of my friends who's a teacher, a primary school teacher, was saying that what's amazing is how quickly they've adapted to the sort of whole concept of social distancing in these small children in schools. And I mean, it sounds horrendous in some ways, this idea that young children have to socially distance, but they've and also adapted to some teachers wearing face masks and that kind of thing. The teachers say it's amazing how adaptable young children are. And in terms of the long-term effects, I think we don't know. Going back to the whole idea of a natural experiment, we don't know. But perhaps it will depend on the duration of this situation we're in. So if it's 2 or 3 months with no school and much reduced play is so important for young children, then maybe that will have less serious long-term consequences, perhaps none, on young children's development than if this goes on for many months or even years.
Ed, Catherine says, I'd like to ask what's been the impact of the media and the very emotive language and images that have been flooding our screens. Has that had a role in exacerbating mental health issues? So apart from just the effects of possibly coronavirus infection, is there coronavirus impact secondarily through being terrified and scared out of your wits because of what might happen?
Well, I mean, I think it's a very plausible idea. There's certainly a lot of, there's a torrent of media about COVID, of course. I mean, I personally, I find myself rationing my exposure to it. And I'm just looking at mainstream websites. I think if you start going into sort of the more sort of the wilder fringes of the internet and picking up on some of the conspiracy theories about where this virus has come from and how it might be having its effects, you can be exposed to some deeply alarming and completely fake news about what's going on, which is only going to make the anxiety levels worse if people are already anxious, and that's why they're searching for sort of esoteric information about this. So I think that is a real risk. But I just wanted also to come back to this thing that we've been talking about, the sort of the inequalities of the impact. And I think one other group that's worth mentioning is the people that had pretty serious mental health disorders before COVID hit. And they're a group, obviously, that we're quite worried about in terms of future mental health. We know that people who had serious mental illness have, dramatically shortened life expectancy compared to others even before COVID. And that mortality gap, as we call it, has actually widened. So it seems from the data that we've been getting hold of in Cambridgeshire that actually having a serious mental illness puts you at higher risk of having a very bad outcome from the infection. And then even if you're not infected, you've still got the problem of how do you access services? And we've talked about digital in the lives of young children, which is potentially a lifesaver. But, mental health services, in fact, the NHS as a whole, is not very sophisticated digitally. We're going to have to sort of see a dramatic acceleration of how the NHS has adopted new technologies if we're going to find safe ways to reach out to patients and talk to them and interact with them. Bearing in mind, of course, that particularly the sort of people who are anyway sort of more isolated or vulnerable or struggling with a long-term condition, maybe impoverished, may not have digital connectivity. I mean, it's easy to assume that the whole world is connected digitally, but there are, a substantial number of people who are not. And despite the question about the possible adverse impact of media, I think there is still much more to be gained from digital contact with the outside world, and there is a significant group of people who will be deprived of that potential benefit.
Thanks, Ed. Just to remind everybody, do keep your questions and comments and perhaps reactions to what we're saying coming in via the chat. Just on the basis of what you were saying, Ed, Delphine says, any research on the impact on elderly people in senior homes and the impact of the lockdown on their health? My intuition is that loneliness kills people. I guess that's a point that mental health has a mortality attached to it. Mental ill health has a mortality attached to it too, doesn't it?
It certainly does, yeah. And I think, as I sort of briefly mentioned, it's a sort of, one of the sort of most scandalous facts, I think, of life before COVID was that serious mental illness is attached to 10 to 15 years less life expectancy than you'd expect for somebody of the same age but without a serious mental health problem. So these are people at serious risk, not just of psychological problems but of physical health problems too. In fact, one of the things that I think is most positive about the COVID experience has been that perhaps it's beginning to sort of force us to recognize that mental health and physical health go together a lot more commonly than perhaps the traditional medical way of thinking about things would lead us to believe. The medical world sees everything through the prism of its own specialization. But COVID reminds us that actually physical and mental go hand in hand.
Thank you for that. Now, Sarah-Jayne, Fred's made a very important point here, which, as a parent myself with children who are using computers at home to get their education at the moment, I'm concerned about this too. He says, what do we know about the potential short and long-term effects of completely replacing in-person contact with virtual communications, as the lockdown has done for many people? Is this a replacement? Is this replacement different to the social isolation you've been talking about?
It is such a good question, and we don't know the answer to that, which is strange. We should do, because we've had the ability to do studies comparing in-person social interaction with online interaction for many years, but I don't know any research that has systematically, say, longitudinally studied that. I mean, I think anecdotally, though, we all know that it feels very different. It's great that we're able to have Zoom calls with our friends and keep in touch with our families via the internet and via video conferencing, but it is absolutely not the same as a real life in-person interaction where you're in the same room, for a number of reasons. And so I would predict, if I was going to do this experiment, I would hypothesize that it can't replace this kind of interaction that we're having now, can't replace real life interaction in terms of the social needs of the developing child and the developing adolescent, and even adults. I mean, we all need social interaction. And actually, you were talking about loneliness just now. It reminded me of the very big BBC study. I don't know if anyone remembers that, from a couple of years ago. Claudia Hammond carried out a big survey with thousands of respondents on loneliness. And actually, surprisingly, I mean, loneliness amongst older people is such a big worry, especially at the moment if they're shielding. But what the results of her BBC study showed was that the group that self-reported being the most lonely was surprisingly 16 to 24-year-olds. So this is a group who also has the highest access and use of online social interactions, social media, and yet they feel most lonely. I think that's quite an interesting phenomenon, and it's actually a phenomenon that in my group we're about to start studying the effects of. So just going back a bit, we were already starting to become interested in studying the effects of social isolation on the adolescent brain and adolescent mental health. This is with a postdoc researcher called Livia Tomova, who's currently at MIT, but she'll be joining my lab in Cambridge in a couple of months. And for about a year, we've been planning studies looking at how social isolation affects 16 to 24-year-olds. And then that was before COVID. So that, then this, yes, going back to that phrase, natural experiment happened, where young people and everyone are being deprived of their normal levels of social interaction. But so we want to understand how social isolation affects the brain, the brain's reward system, the social brain, and behavior in young people aged 16 to 24, and how social media might mitigate those effects, and try to understand the links between loneliness and mental illness.
Chris,
this is sort of similar to what I was asking Ed just now. Just a second, we'll just deal with this because it's directly relevant. Because Liz says she's got 4 teenagers. 2 of them are missing their social interactions, but 2 of them seem much happier than usual. Is there any evidence that for some teenagers, at least, this new existence is actually beneficial?
Just very briefly, I think that might be right, that for some teenagers, actually school was a socially stressful environment where they didn't know where they were in the social hierarchy. Maybe they didn't really know which group to hang out with. Maybe they weren't included so much. And this just takes them out of that kind of pressure cooker. I've heard that from many people.
Ed?
Yeah, so I just wanted to kind of loop back to the loneliness thing and make one point, which is that because of the sort of risk of infection, there has been more loneliness at the moment of death than we normally see. So patients have been kept away from their families dying in hospital. And I have not, personally been involved with that, but I've talked to many colleagues on the medical side who have, and they have found it themselves very stressful, but they also say that the families have found it extremely difficult. And I think, if we think about what we might do differently next time around, that is one area where I think there is distress that we could mitigate if we thought differently about how to allow families to interact with loved ones as they come close to the moment of death.
So what would be your strategy then? How would we change things? Because at the moment it's all informed by keeping people safe and not causing more infections. So what would you do to surmount the problem?
Well, I don't have a pat answer to it, but I think that what I would say is that in general, we've been surprised by this virus. And there are a lot of things that we did first time around that seemed to make sense at the time, and some of them have stood the test of time and some of them haven't. But what we also know is that although it's only been 6 months that we've been acquainted with COVID, it's not going to go away in the next 6 months. There's a very real risk of this coming around again. I think what is really important, and this is where science and research, I think, play such an important role, is helping us to plan a better response the next time we see this coming. And I would suggest that the point I was making about families being isolated from loved ones at the time of death is just such a thing that might be worth a second look. I don't think we necessarily, first time around, thought that that was going to be an important issue. And I'm not saying it's going to be easy, but I think now that we know more clearly what to expect, that is one small way in which we might be able to optimize our response. And there could be many others as we continue to understand more about this virus.
As Sarah-Jayne was saying, she's actually found herself actively doing a volte-face, as it were, and encouraging her children online. I find myself saying, thank goodness that we have the internet. If this had happened, say, 15 years ago, when there wasn't the same internet connectivity that we have today, I think we would have been in a much worse place, wouldn't we, arguably?
Well, it's interesting about...
Yeah, go on, Ed.
After you.
I was just going to say, yeah, I often think about that. Like if it had happened when I was a teenager, I would have only had the landline, my parents' landline phone, to communicate with my friends. And there was one landline phone, and it was expensive, so probably wouldn't have happened very much. So yeah, I think that just highlights the fact that if there's a positive about this, that it's happened now when we are able to connect with other people online.
A little bit of a handbrake turn coming up. Ed Shan says, I specialise in addiction. During lockdown, I've been unable to enter the prison to work with a cohort of prisoners who are trying to recover from addiction. I believe that online porn has increased significantly. What are your thoughts on the increase in addiction? I mean, porn can be addictive too, can't it?
Yeah, porn can be, I mean, frankly, anything that you might regard as normally rewarding can become abnormally addictive. I mean, I think that's so, but certainly alcohol and drug use. I mean, I said earlier that when we've looked at what happened to people seeking mental health services in Cambridgeshire, for almost everything that drops off a cliff when lockdown hits, when you look at the data, and we're not seeing it back to where we'd expect it to be. The one exception actually is drug and alcohol. We are already seeing more people seeking treatment for addiction than we would have expected this time last year.
Do you think that's just because of the commute? Because I've had it put to me that some people are saying to me, because I'm not spending an hour on the road going home from work, and I'm not spending an hour on the road in the morning going to work, so I can sleep in for longer. Actually, the evening's now quite a bit longer, and I can go to bed a bit later, and I'm finding I can fit in a few more drinks.
Yeah, I think that's one possibility. I mean, that I think there are likely to be a number of different sort of circumstances for individuals. Boredom, self-medication. Particularly if people aren't accessing their GPs and other health services, they may turn to the bottle or other drugs as a way of medicating themselves out of, the distress that they feel about the situation they're in. As with all of this, one of the problems is that lockdown has deprived us of contact with patients, and patients have been deprived of contact with services. So to some extent, we have to guess what's going on in all these lockdown homes around the country. But as I say, already we're seeing a spike of new referrals come through, and I think addiction, exacerbation of addiction, perhaps the sense that the world is not operating normally, the normal rules don't apply, is certainly going to be fueled by this.
Is that a big
Definitely.
risk for teenagers, Sarah-Jayne? Because of course they're potentially more impressionable during the adolescent phase and more likely to perhaps embrace illicit substances.
Definitely, but one discussion that's been had a lot with people who work with teenagers, including teachers, is that actually lockdown meant that teenagers were not able to go out and get drunk and take drugs when they might normally have been doing that at the weekends. That's quite an interesting change, and in some ways, positive. But then the worry is that as soon as they're allowed to socialize again, they'll make up for lost time. But yeah, I do some work in South Africa with teenagers in rural South Africa, and this is not about the research. Well, it's research on teenagers who have depression there. But my colleagues now working in the hospitals in South Africa, because they got kind of reassigned to hospital work as soon as COVID started, the outbreak happened out there. But they were telling me the other day that alcohol throughout lockdown, which is very, very strict in South Africa, has been banned. So you can't buy alcohol because they knew that this was a real risk of people, who couldn't work, just turning to alcohol, and then that creating lots of violence and domestic abuse, which is already a real problem in South Africa. Anyway, they started to reintroduce the sale of alcohol about 10 days ago, and my colleagues in hospitals in South Africa said there was a huge surge in alcohol-related accidents and even mortality as soon as they started to sell it again.
One of my colleagues at the BBC, when all the panic buying was happening at the beginning and you couldn't buy a bog roll for love nor money in the shops, she emailed me and she said she'd been panic buying, and I wrote back and said, what? And she said, Shiraz. So I think it's perhaps class dependent, isn't it? Isn't it different sectors of society this perhaps applies to more than others? Or is it the classic U shape where you've got the extremes at the top and bottom end of the social spectrum who are most vulnerable to this? What do you think?
I don't know, but we should have the data on that. I mean, there must be data on alcohol sales over the last 3 months and who's been buying it what.
Do you know, Ed, if that exists?
I'm sure it does exist, but I haven't seen those data. I mean, I think that's a good way of looking at the problem, actually, because that's something that people have been able to do. They might not have been able to go and talk to their GP, but they have been able to nip out to the supermarket and panic buy a bit of Shiraz. I just wanted to come back to the point that you were discussing earlier about connectivity, digital connectivity. Could we have survived without Zoom? It's just worth reflecting that, connectivity is a very mixed blessing, actually, when it comes to epidemics, as you'll know, Chris. I mean, if you compare the rate at which COVID has gone global to the rate at which, let's say, Spanish flu, the pandemic around 1918-19, moved across the world, this is happening at a different pace. And a lot of the cities that have been hit hardest, like London, New York, are, of course, highly connected travel hubs. So our physical connectivity has arguably been part of what's made us so vulnerable to COVID. And maybe our digital connectivity is what's going to help us get out of it at the other end. And one other aspect of connectivity that I think is worth highlighting is what this crisis has done to the sort of culture of scientific communication, collaboration, and sharing. The scientific community under normal circumstances is slightly sort of, siloed and secretive and, well, not secretive, but, there is a sort of strong competitive culture. And one of the positives of COVID is how it's galvanized the global scientific community. So you have much more sharing of information earlier, much more connectivity in that sense of information exchange, knowledge exchange. So I think that's a real positive.
It's time to wrap up. So I think I should offer you both a sort of passing or departing thought for the day, as it were. So Sarah-Jayne, your parting thought for the day on where you see this going next, and perhaps something for people to think about on their way home?
Yeah, well, it will be very interesting to see the results of many, many studies that are currently being carried out on mental health during COVID. I know I saw this morning a preprint from 2 big studies, one in England, one in Scotland, showing that anxiety, the levels of anxiety have massively increased, particularly in young people and in women since the lockdown. And it will be so important to understand how the lockdown and anxieties around COVID affect mental health, because as Ed said earlier, this is probably going to be with us for quite a long time, and there will be epidemics in the future, so we've got a lot to learn.
Ed?
Yeah, I think my thought is let's learn and not look back. I think there is a tendency sometimes to look back and spend too much time thinking about what we could have done differently in this country and elsewhere. And I think what really is important is that we take a very constructive attitude to the future, make sure that we learn the lessons and we think as positively as we can about the longer term consequences of this pandemic, not just reducing it to ventilators and ICU, but thinking about the longer term and thinking how can we use what we've already learned to make a next wave less terrifying than the first, and to make sure that particularly the vulnerable groups in society that we've been talking about a fair bit today, that they have the best possible chance to survive this without too much widening of the social inequalities that Sarah-Jayne was talking about earlier.
Well, thank you both very much indeed. Very thought-provoking, Ed Bullmore and Sarah-Jayne Blakemore. And if you'd like to listen to any more or catch any more of these Cambridge Conversations, they're on the Cambridge Conversations YouTube channel. If you look up Cambridge Conversations, you can find the so far 3 previous editions alongside this one. There'll be another one along soon. Thanks for listening. I'm Chris Smith. Bye-bye.